Hello, welcome back to Mirror Interpretation Todorova. Welcome back to my YouTube channel. What do you guys think about my, I don't even know how it's called. I think it's pretty cute. Um, my name is Ioana and I am an interpreter with Bulgarian, Italian, Russian, Macedonian, and English working in the USA. So I'm creating this video about the cultural practices. So I had a question from Gabriela. Hello, would you please publish a video talking about cultural practices, about families and relational structures? Okay, guys. So if you have done the training for medical interpreting, there is something called conflict of interest. National standards of best practice, best protocol talk about it. California standard talk about it. So you could see there is a lot of rules that implement for interpreters to stay impartial, especially the rule impartiality. There is a rule of the gifts and so on. But I know that these cultural American rules, or how to call it, the cultural legal system and the obligation that the system puts you are very different sometimes from what culturally could be appropriate in families. For example, I know that in some cultures, they have a lot of like power. The parents have a lot of power and control over adults, and I'm not talking about teens, I'm talking about the daughters, like in Muslim families. And sometimes families do not allow this privacy between a doctor and a patient, or sometimes let's say the daughter has some problems, and the families are there, or relatives or mothers, they don't know what is it, let's say OBGYN, they don't understand this, they are unaware what exactly this means for their child health or daughter health, and so on. So a lot of those practices and standards tell you that you should constantly grow up and culturally develop. Unfortunately, none of those practices or standards or protocols give you information on how to actually develop your cultural awareness. But they give you one thing called be aware of your own culture. For example, in my country, low register, I'm talking about the gypsies, Turkish people. There is a small Islamic community in Bulgaria, and so on, that have different religions. No, in my country, although the most of the people are Christians, they do have the Muslim culture, and they do have some traditions for Muslim culture as well, and also they have some gypsies that have different beliefs. For example, some of those cultures have belief that people start to live after death, and if somebody died, they make huge parties. It's called culture of Lakos, and for them death is not something you cry. Then we have another gypsies in Bulgaria where if somebody dies, they pay somebody to go to their grave and cry for 1 month, and you could hear at certain hours somebody's crying. It sounds like a wolf noise. I have heard that, trust me, guys. And so there is a different cultures, even though in the same countries, in the same place. For example, in my country, if you are interpreting for low register, um, all the questions related to OBGYN are extremely shameful. So I work for one clinic for UK, for one emergency room there, and I work for gypsies. I'm serious. There is nothing wrong with this. I will tell you that they were more respectful than the ones that think that they are aristocratic or something like that. So those gypsies, they usually, for example, last week I had a call where the girl had an infection and she had to stay in the hospital, but She didn't want to decide before she asked the opinion of her mother. This is a cultural thing. So the doctors advised her and tell her, what do you like to do? And she said, okay, let me talk to my mom. I like to go out. Can I go out and meet her? And they said, yes, of course. So in a lot of cultures, I guess, what I'm trying to say, in a lot of countries, the decision of somebody's life, healthcare decisions are on the shoulders of, I'm talking about the shoulders of the parents, and I'm talking about low register. At the same time, you can see, and I see these tendencies here in the USA, where the healthcare decisions would be on the shoulders, on the weight of the children. I'm talking especially Orthodox, maybe Kafkaz, maybe some countries, Azerbaijan, some of these very fascinating countries, in my opinion. The decision would be on the children after a certain period of time. When the parents get older, they would write a document called advance directive. You probably guys know what is that. And on advance directive, they would usually put the children to decide. If you're unable to decide, if you're unable to do something with your health, name a person who can decide instead of you. And usually the weight of the medical decisions go to the daughters and the sons. This is something very normal. Also talking about medical plans, re-enrolling, resubscribing, questionnaire filling. A lot of those elderly people give this power to their children. I'm talking about Russians here. But this depends on the culture, no? So the legal system in USA, this is a gap, try to impose American beliefs in healthcare. I know I will be hated probably for saying that, but I will give you example. Unappropriate topics, cultural differences and cultural practices. So in American healthcare, there is this questionnaire that I honestly don't understand why some of these clinics, I have experienced this on me, and although I'm not close-minded, this is adult content, please don't, it's not for children. So I'm gonna share some questions that this nurse asked me. So I went to do a test, OBGYN test. I don't do it every year, I'm bad, but maybe last year, 2 years ago. So I just wanted to do the check, which take the swab and the blood test. I haven't done it for 2 years, or 3. So I went to this clinic, and the test should have lasted 20 minutes, the check and the blood test. It lasted 2 hours and a half, and the reason why is because one of these nurses asked me 1 gazillion thousands of questions that I don't see how could be related to her, having in mind that she was not my primary care physician. So some of these questions were, how many sexual partners have you had? I honestly don't think that this is business of the doctor or the nurse that was visiting me because I wanted to do this test to check my health. Neither any person I know, I think, that should ask me those type of questions. Then the question go beyond that, asking me how many partners I had at this time. I don't think in the last 4 or 5 months I had any partner, so I didn't know what to answer her. So then she asked me, because I said, I don't know what to tell you, she continued pressuring to ask me for the last, because it was long period of time, so she pressured to ask me about in the last year and in the last 2 years until she get a number. When she get this number, I think it was like 2 partners, something like that. She asked me if these partners are males or females. Once again, I am mentally open, but I don't see why does it matter to the doctor, my sexual life? I think this nurse was a like LB lesbian, gay, queer community, something like that. I am not against it, but I just don't understand why this matter to a nurse if I had experience with a female or male. If we're talking about disease, they can transfer equally. Nothing changes. You can get disease without even having intercourse, with just a kiss, you know. Some infections can be transferred even with a cough. So I just didn't understand why was this question. Also, the questioner continued to asking me if I had a specific type of sex or not. Then she asked me if I use toys. I know, guys, I know. This is for me that I feel like I'm a multicultural person. I have lived in a different countries. I have lived in Italy, in Greece, Bulgaria, spent some time in Spain, France, UK, Canada, USA, sometime in Mexico. I feel like this is inappropriate even for here. I don't see any reason why anyone would ask me those questions. Why anyone would ask me if I use a toy with a condom, for example. So there is some things in the healthcare system here in the USA that are not culturally appropriate for me, that I believe I'm open-minded, but I just don't see how this can be useful for this nurse, for her. I just wanted to do the lab. I don't see how this questionnaire is related to the lab and what information will give to this doctor, having in mind that I'm a young lady, 100% healthy. If I had some specific disease, I also did an HIV test, which came right away, it was negative. So if I had like hepatitis or something like that, some serious disease, which I did not have even, not even a slight problem, nothing, I would understand if she want to ask specific questions based on the test results. But saying hello and asking those type of questions are inappropriate, I believe, strongly inappropriate, not only for me, but I cannot imagine if the person is coming from a religious background. For example, Christian, that only very serious partners, they get intimated, where the word sex and sexuality is a shameful word. You should not pronounce it, and you should hide your sexuality as much as possible, and your sexuality should be used to reproduce and make kids only, no? Or if the person comes from very conservative background and culture, like Muslim or extreme Catholic church and these type of things, where you should do sexual activities only after you're married. Not only, but happened to me to interpret for this clinic for a husband and wife, where the lady had some problem, and it was some kind of a STD, and it was from Muslim background. They were married, where they have to marry virgin, and they asked her how many partners she had. This is not only offensive, but this is extremely culturally inappropriate. This is like shameful to ask. A lot of people are stunned by these questions, and I think that talking about cultural sensitivity and cultural awareness, I believe that healthcare interpreter system need to be updated, including those sensitivities. Because if in your culture it's not appropriate to have multiple partners, it's not appropriate to ask this question in front of your husband, first of all. And if let's say happened that somebody from this background had something like that, it's not appropriate to ask this question in front of friends, family, and relatives. The doctor or the provider should request the patient to be alone with her. and said that everything she shared would be kept confidential, and for medical reason to ask this question if she really have to, if there is some problem with the health of this person. Not only, but I will tell you, I was interpreting for this session, it just came in my head right now. The lady was having this infection, obviously a Muslim background, obviously one partner lifetime only, where the nurse was telling her, you have this infection because your husband has cheated on you. He had sex with another person. I just don't understand, like, anyways. So, American healthcare system is not culturally sensitive, and the rules that they apply are not culturally sensitive to other cultures. We are playing very sensitive here, and we are playing very open democracy and all that. Although America does have some things, there is a gap on the system talking about cultural sensitivity, cultural awareness, and what things are appropriate to be talking about or not. Family relationships, in some of the cultures, the families or relatives are very noisy. A lot of them, especially low register. In my culture, and a lot of the times, the doctors do not keep the information confidential, and they do share it with, let's say, relatives or people that are in the room. They don't ask the patients. Let's say it's a mother and a daughter. By culture, they have to share everything, right? So if the doctor asks the daughter in front of the mother, it's okay if your mom stay, of course the daughter would say yes, because if she say no, she would offend her mother, right? So she kind of have to say yes, although maybe she feel uncomfortable with her mother being there discussing her sexual life. You know what I mean? So the family structures and the cultural awareness have one thing, because in different cultures, the beliefs behind it, it's different, right? As I said, in some family structures, they have to all go together. I know Latinos are like that. They're also very possessive and so on. Some extreme or religious people are like that, they don't give space. There is no boundary between one person and another. There is no boundary in the couples, right? There is no boundaries between the parents and children. Even the children are adults. The parents are there and the parents decide instead of the children, because parents believe they know better. There is no individual separation in these family structures in the culture, because of the cultural background. And because of that, in a lot of those sessions, you could tell that the patient is lying to the doctor. And the reason why is because they cannot break these cultural beliefs about sexuality, about some of them doesn't have a full sexual contact, but they do have some of these encounters that bring them problems. So this question, Gabriela, it's very complicated. It's very difficult to address, because American system, it's a little bit selfish in a way that none of those legal people or people that stand behind creating the rules and talking about cultural awareness allow and give a right to the interpreter to refuse to interpret something that is extremely offensive and culturally inappropriate. Also, they are not respecting the culture of the other persons or the language. Or for example, I remember that I was interpreting for this elderly couple, married for 60 years. It was in one of the clinics here in Denver, and I don't know for what reason the doctor asked them if they was from Kafkas, people from Siberia, people that it's not appropriate to cheat It's not appropriate to lie. It's not appropriate to betray your partner. You know, they have this really, really like values, moral values, and beautiful things, you know. And asking those type of questions is insult to where these people are coming from. So being in marriage 65 years and you ask them if they had extramarital partners, it's inappropriate for me. It's ridiculous, and it's something you should not ask this type of people. But once again, this is because the cultural differences. I guess here in the USA, people they have these extremities. They have one extremity of this church people that deny their own sexuality and their own personal sexual being, if you want to. And then you have the other extremity, people that are a little bit victims of the consumption system, that are trying to have intercourse with as much people as they can, and they believe this is some kind of a success, which is very sick. I think the both things are very sick, and then you can find a very thin layer of people that understand that sexuality is not everything in a human, and it's just one shade of a color of a human being. It's a one little piece, and the relationships, the friendships, and all that is not based on sexuality and sexual contacts with others. Uh, these cultural tendencies are happening here in the USA with people that are born here, once again, coming from different backgrounds, coming from different families. Depends also, again, parent neglecting and so on and so on. This all affect the individual. So I believe that's why the cultural thing is so complicated to be addressed, because it's individual matter. You can grow in certain type of culture and belief system, but you can grow, develop yourself, and open your mind, and not be classical representative of this culture that you come from. You can have part of it, accept part of it that is in accordance with your belief system, and part of it maybe not. So there are best practice, best protocols talking about cultural awareness, cultural practices. Also, there is different things in different countries, in the same countries too, but what is appropriate to wear. For example, Latino culture, you have to wear these skimpy clothes that show your body. A low register Bulgaria as well. Low register many countries, more skimpy, more you show, more beautiful and sexy you are, more transgressive you wear yourself. Um, then there is this religious people that they have to dress very conservative and not show parts of their body. And then this is extreme religious people that will wear burqa and burqa on the eyes too, to cover their faces. This is also very, very different, even talking about clothes. The cultural practices, there is a video that is called Cultural Awareness. I will link it above here for you, Gabriela, and you could check it out. There is also a video that I create with Jose talking about Latino culture, what's appropriate and not. I will link that folder for you as well. That question is very interesting, but it's very difficult to address it as general as it is. It's also a very complicated question, because every culture have different things that are considered inappropriate. For example, if you go to Kazakhstan and you wear t-shirt, you are like seen a very not okay. You're seen as an easy woman. In India, for example, if you wear shorts and you could see, they could see your knees. I was volunteering in this camp in Canada, and I wear this shorts. It was exactly shorts up to my knees, and one of the ladies commented that this is not appropriate, and it was very aggressive with me. One of the ladies in the center. Also, in India, it's considered polite to take whatever they give you with the right hand. and if not, is considered offensive. There is different things. For example, in the temple, if you cross your leg, is considered offensive. There is different, or if you enter with your shoes, oh God forbid you cannot enter there. Or for example, in a Muslim culture, there is separate places for female to pray and male to pray. You understand that, right? In the church, extremely Catholic church, you have to cover your head, your hair, you know. So every culture have these very specific things that unless you know and unless you actually grow these cultural limiting beliefs, you would not be able to know them. You're not gonna be able to recognize them, and you will, if you don't know any other culture but the culture where you come from, if you never get out of your village, of your comfort zone, of your city, or if your home environment. For example, I had a friend, Amir, and he was half Italian, half Palestinian, I believe. And he shared with me that when he visited the relatives in his country, there was in the house separate place for women and for guys. And for him, this is a huge cultural shock and stress. In a lot of the Muslim students that used to come to study in Italy, in their culture, is not appropriate to speak with the girls at all. It's like weird. And when they move to Italy and in the university there is guys and girls in the same class, this is extreme cultural shock that they experience there. I had a colleague sharing with me that it's not even about like being in contact with someone, but the fact that you can talk to a girl, because in their countries, in order to talk to a girl, you have to be going to be marrying her, and it's happening only in front of her parents. I give in Azerbaijan, Kazakhstan, and all these countries. So imagine for a person that come from these backgrounds that they can only talk to a girl in front of her parents and meet her when they are in the process of being engaged, and not even see her completely, but see how she put the tea or bring the candies or the pastries into the guests. Suddenly to go into a culture where they're able to speak to a woman that doesn't cover her face and that have her opinion, where in those countries women have to obey to the male's opinion and agree to everything he say, even if it's a huge nonsense, because the culture says that a woman have to obey to her man. Said that, Gabriela, I don't know where you're from, but I will tell you that in a lot of these countries, I'm talking about Latino countries, machismo, maschilismo in Italiano, or misogynista in English, it's a very common culture where males, or the role boundary of a male in the family, in the society, is one step above a female. And of course, in these cases, having this cultural baggage, but also being able to make the difference between your own culture and American culture and the culture of other people that you interpret, it takes a lot of practice, a lot of knowledge. For example, some countries, shaking a female hands is considered sin. It's a considered bad thing. Even looking to a woman during Ramadan is considered bad. And there is so much into this topic that I am unable to unfold it in one short video here. If you have a more specific questions, you can address them. Or if you guys have something to share here, you can write it in a comment below. Well, that was my gossiping about the cultural awareness, the family structure, the religion that goes inside, the male structure in the society and in the family, and in the culture itself, the role boundaries between females and males in a different levels of education, lower and higher register, could be different even if they come from the same country and the same background. So Thank you, Gabriela, for this question. If you guys did like this video and if you want to support me, you can press like and share and subscribe and press the bell button so you can be notified each time I create a new video. If you want to know and if you want to ask a question, you can subscribe for $3.99 where I will address your questions for members only. If you like, you can subscribe for $7.99 where you're gonna find information about job interviews, where I apply for jobs, what I do as an interpreter, challenging testings, experience, interviews, and stuff like that. I think right now there are about 30 videos in this folder for level 2 members. Thank you guys for being here, and I hope you have a great day. Bye-bye.